Introduction to Cosmetic Dermatology. Cosmetic dermatology is a specialized field focused on improving the aesthetic appearance of skin, hair, and nails. It encompasses a broad range of non-surgical procedures designed to address concerns such as aging, sun damage, acne scars, pigmentation issues, and unwanted hair. This discipline combines medical science with aesthetic principles to achieve optimal patient outcomes. Practitioners in this field utilize advanced techniques and technologies to enhance natural beauty and restore skin health. Understanding the patient's goals and expectations is paramount in developing effective treatment plans. The field is constantly evolving with new research and technological advancements, requiring continuous learning and adaptation. The primary goal of cosmetic dermatology is to help individuals achieve healthier, more youthful, and radiant skin while maintaining natural-looking results. It involves a holistic approach, considering not only specific skin concerns, but also overall skin health and lifestyle factors. This introductory section lays the groundwork for understanding the scope and importance of cosmetic procedures. It highlights the blend of artistry and scientific rigor required to excel in this specialized area. The emphasis is on safe, effective, and evidence-based practices that prioritize patient well-being and satisfaction. Skin anatomy and physiology review. A thorough understanding of skin anatomy and physiology is fundamental to effective cosmetic dermatology. The skin, our largest organ, comprises three main layers: the epidermis, dermis, and hypodermis. Each layer has distinct structures and functions that contribute to the skin's overall health and appearance. The epidermis, the outermost layer, acts as a protective barrier against environmental aggressors and regulates hydration. It contains keratinocytes, melanocytes, Langerhans cells, and Merkel cells, each playing a crucial role in skin protection, pigmentation, immunity, and sensation. Understanding these cellular functions is vital for targeting specific cosmetic concerns. Beneath the epidermis lies the dermis, a thicker layer rich in collagen and elastin fibers, which provide the skin with strength, elasticity, and resilience. This layer also houses blood vessels, nerve endings, hair follicles, and sweat and sebaceous glands. The health of the dermis directly impacts the skin's firmness, texture, and youthful appearance. The hypodermis, or subcutaneous tissue, is the innermost layer, primarily composed of fat cells and connective tissue. It insulates the body, stores energy, and provides cushioning. Knowledge of these intricate structures allows practitioners to select appropriate treatments and predict their effects on different skin depths. Skin types and conditions. Identifying different skin types and common dermatological conditions is crucial for personalized cosmetic treatment. Skin types are generally categorized as normal, dry, oily, combination, and sensitive, each requiring specific care and product recommendations. Normal skin is balanced, neither too oily nor too dry, with minimal imperfections. Dry skin often feels tight and may show flakiness, lacking sufficient sebum production. Oily skin presents with excess shine, enlarged pores, and a propensity for breakouts due to overactive sebaceous glands. Combination skin exhibits both oily and dry areas, typically an oily T-zone and drier cheeks. Sensitive skin reacts easily to products and environmental factors, often showing redness and irritation. Accurate assessment of skin type guides the selection of appropriate cosmetic procedures and home care regimens. Beyond basic skin types, cosmetic dermatology addresses a wide array of conditions that impact skin appearance. Common concerns include acne vulgaris, characterized by blackheads, whiteheads, papules, and cysts, often requiring targeted treatments. Rosacea manifests as facial redness, visible blood vessels, and sometimes bumps or pustules. Hyperpigmentation, such as melasma and sunspots, involves uneven skin tone due to excess melanin production, fine lines and wrinkles. Loss of elasticity and textural irregularities are signs of aging that are frequently managed. Other conditions like scars, stretch marks, and enlarged pores also fall within the scope of cosmetic intervention, each demanding a tailored approach for effective improvement. Patient consultation and assessment. The initial patient consultation is a critical step in cosmetic dermatology, establishing rapport and gathering essential information. It involves a detailed medical history, including past and present health conditions, medications, allergies, and previous cosmetic procedures. Understanding the patient's lifestyle, sun exposure habits, and current skincare routine is also vital. During this phase, the practitioner must actively listen to the patient's concerns, aesthetic goals, and expectations. It is important to ascertain their motivations for seeking treatment and to manage any unrealistic expectations. A comprehensive consultation ensures patient safety and satisfaction by identifying potential contraindications and tailoring treatments appropriately. Following the history taking, a thorough physical assessment of the skin is performed. This includes evaluating skin type, texture, elasticity, hydration levels, and the presence of any specific conditions like acne, pigmentation, or vascular lesions. Digital imaging tools such as dermoscopes or specialized cameras can be used to document baseline conditions and track progress over time. Based on the gathered information, the practitioner develops a personalized treatment plan, discussing the proposed procedures, expected outcomes, potential risks, and post-procedure care. Informed consent is obtained, ensuring the patient fully understands and agrees to the treatment plan before proceeding. Clear communication and patient education are key throughout this process. Topical agents and cosmeceuticals. Topical agents and cosmeceuticals form the cornerstone of many cosmetic dermatology regimens, offering non-invasive solutions for various skin concerns. These products contain biologically active ingredients that provide both cosmetic and therapeutic benefits. Key categories include retinoids, which promote cell turnover and collagen production, improving texture and reducing wrinkles. Antioxidants like vitamin C and E protect against free radical damage and brighten the skin. Alpha-hydroxy acids, AHAs, and beta-hydroxy acids, BHAs, exfoliate the skin, addressing issues like acne and hyperpigmentation. Peptides stimulate collagen synthesis, while growth factors aid in skin repair and regeneration. Understanding the mechanism of action for each ingredient is crucial for recommending effective home care. The proper selection and application of cosmeceuticals are essential for optimizing treatment outcomes and maintaining skin health between in-office procedures. Practitioners must educate patients on how to incorporate these products into their daily routines, emphasizing consistency and proper layering. Factors such as skin type, specific concerns, and potential sensitivities must be considered when recommending products. For instance, sensitive skin may require milder formulations or lower concentrations of active ingredients. Combining professional treatments with a tailored cosmeceutical regimen often yields superior and longer-lasting results, reinforcing the importance of a comprehensive approach to skincare. Chemical peels, principles and types. Chemical peels are popular cosmetic procedures that involve applying a chemical solution to the skin to exfoliate the outer layers, revealing smoother, more radiant skin underneath. The depth of the peel determines its intensity and the conditions it can treat. Superficial peels, using agents like alpha-hydroxy acids, AHAs, or beta-hydroxy acids, BHAs, target the epidermis and are effective for mild sun damage, fine lines, and acne. Medium-depth peels, often using trichloroacetic acid, TCA, penetrate deeper into the dermis, addressing moderate wrinkles, actinic keratoses, and more significant pigmentation issues. Deep peels, typically phenol-based, are reserved for severe sun damage, deep wrinkles, and extensive scarring, requiring significant downtime. The selection of the appropriate chemical peel depends on the patient's skin type, concerns, and desired outcomes, as well as their tolerance for downtime. Proper patient preparation, including pre-treatment with retinoids or hydroquinone, can optimize results and minimize complications. During the procedure, the solution is carefully applied, and the skin's reaction is closely monitored. Post-peel care is crucial for healing and includes gentle cleansing, moisturizing, and strict sun protection. Potential side effects include redness, swelling, peeling, and temporary hyperpigmentation, which can be managed with proper protocols. Understanding the different types and their indications is key to safe and effective practice. Microdermabrasion and dermaplaning. Microdermabrasion and dermaplaning are mechanical exfoliation techniques that gently remove the outermost layer of dead skin cells, revealing a fresher, smoother complexion. Microdermabrasion uses a device that sprays fine crystals or uses a diamond-tipped wand to abrade the skin's surface while simultaneously vacuuming away the exfoliated cells. This process stimulates cell turnover and improves skin texture, reducing the appearance of fine lines, mild acne scars, and enlarged pores. It is a non-invasive procedure with minimal downtime, making it a popular choice for skin rejuvenation. Regular treatments can enhance product penetration and maintain skin vitality. Dermaplaning involves using a sterile surgical scalpel to gently scrape off the top layer of dead skin cells and vellus hair, peach fuzz, from the face. This manual exfoliation technique leaves the skin incredibly smooth and soft, creating an ideal canvas for makeup application and improving the absorption of skincare products. Unlike microdermabrasion, dermaplaning does not involve suction or crystals, making it suitable for some sensitive skin types. Both procedures are effective for improving skin radiance, reducing superficial imperfections, and promoting a more even skin tone. Proper technique and adherence to sterile protocols are paramount for patient safety and optimal results with both microdermabrasion and dermaplaning. Laser and light-based therapies. Laser and light-based therapies represent a significant advancement in cosmetic dermatology, offering targeted solutions for a wide range of skin concerns. These technologies utilize specific wavelengths of light to selectively target chromophores in the skin, such as melanin, hemoglobin, or water, without damaging surrounding tissue. Different types of lasers and light devices are employed for various indications. For example, intense pulsed light (IPL) is effective for treating sun damage, brown spots, and vascular lesions like rosacea. Ablative lasers, such as CO2 and air YAG, vaporize superficial skin layers to address deep wrinkles, scars, and textural irregularities, promoting significant collagen remodeling. Non-ablative lasers stimulate collagen production without removing the outer skin layer, leading to less downtime. Fractional laser technology delivers microscopic columns of laser energy, creating controlled micro-injuries that stimulate the body's natural healing process and collagen synthesis, while leaving surrounding tissue intact for faster recovery. This approach is highly effective for improving skin texture, reducing scars, and minimizing fine lines. Pulsed dye lasers, PDL, are specifically designed to target vascular lesions, such as port wine stains and spider veins. Proper patient selection, understanding the physics of light-tissue interaction, and meticulous technique are crucial for achieving safe and effective results with laser and light therapies. Comprehensive training in device operation and safety protocols is essential for practitioners in this advanced field. Injectables. Botulinum toxin. Botulinum toxin, commonly known as Botox, is one of the most popular and effective injectable treatments in cosmetic dermatology. It is a neurotoxin that temporarily relaxes specific facial muscles responsible for dynamic wrinkles, such as frown lines between the eyebrows, crow's feet around the eyes, and horizontal forehead lines. By blocking nerve signals to these muscles, it prevents them from contracting, leading to a smoother, more youthful appearance. The effects typically last 3 to 6 months, after which muscle activity gradually returns. Understanding facial anatomy, particularly muscle groups and their functions, is paramount for precise and natural-looking results. Proper dosing and injection technique are critical to avoid complications and achieve desired outcomes. Beyond wrinkle reduction, botulinum toxin has various other cosmetic applications. It can be used to treat hyperhidrosis, excessive sweating, by blocking nerve signals to sweat glands in areas like the underarms, palms, and soles. It can also be employed for jawline slimming by reducing the size of the masseter muscles, and for treating gummy smiles by relaxing the upper lip muscles. The procedure is generally quick, minimally invasive, and requires no downtime. Patient consultation is essential to discuss expectations, potential side effects like temporary bruising or asymmetry, and to ensure the patient is a suitable candidate. Continuous education on advanced injection techniques and safety protocols is vital for practitioners. Injectables. Dermal fillers. Dermal fillers are injectable substances used to restore volume, smooth wrinkles, and enhance facial contours, providing immediate and noticeable results. Most modern fillers are composed of hyaluronic acid, HA, a naturally occurring substance in the skin that attracts and holds water, providing hydration and plumpness. HA fillers come in various formulations, differing in their viscosity and cross-linking, allowing them to be tailored for specific areas and concerns, such as lip augmentation, cheek enhancement, or filling nasolabial folds. Other types of fillers include calcium hydroxylapatite, poly-L-lactic acid, and polymethyl methacrylate, each with distinct properties and longevity. The choice of filler depends on the treatment area, desired outcome, and patient characteristics. The procedure involves injecting the filler into specific areas of the face using a fine needle or cannula. Proper injection technique, including depth and placement, is crucial to achieve natural-looking results and minimize complications. Dermal fillers can address age-related volume loss, improve facial symmetry, and soften static wrinkles. Potential side effects include temporary swelling, bruising, redness, and tenderness at the injection site. Serious complications, though rare, can include vascular occlusion, making a thorough understanding of facial vascular anatomy essential. Practitioners must be highly skilled in both injection techniques and complication management to ensure patient safety and satisfaction. Patient education on pre- and post-treatment care is also vital. Sclerotherapy for varicose veins. Sclerotherapy is a medical procedure used to treat varicose and spider veins, improving both their appearance and associated symptoms like aching or swelling. It involves injecting a solution called a sclerosant directly into the affected vein. This solution irritates the lining of the vein, causing it to swell, stick together, and eventually scar shut. Over time, the treated vein fades and is reabsorbed by the body, redirecting blood flow to healthier veins. Sclerotherapy is highly effective for small to medium-sized varicose veins and spider veins, offering a minimally invasive alternative to surgery. The procedure is typically performed in an outpatient setting and requires little to no downtime. Before the procedure, a thorough assessment of the patient's venous system is conducted, often using ultrasound to map the veins and identify any underlying issues. During the treatment, multiple injections may be administered, depending on the number and size of the veins. After the injections, compression stockings are usually worn for a period to help keep the treated veins closed and promote healing. Potential side effects include temporary bruising, swelling, skin discoloration, or tenderness at the injection sites. Serious complications are rare, but can include allergic reactions or skin ulceration. Patient education on post-procedure care and expectations is crucial for successful outcomes and patient satisfaction. Non-surgical fat reduction. Non-surgical fat reduction treatments offer effective alternatives to liposuction for individuals seeking to reduce localized pockets of stubborn fat without invasive surgery. These procedures target and destroy fat cells using various technologies, including cryolipolysis, controlled cooling, radiofrequency energy, heating, and ultrasound, sound waves. Cryolipolysis, commonly known as fat freezing, works by exposing fat cells to precisely controlled cooling, causing them to crystallize and die, after which they are naturally eliminated by the body. Radiofrequency devices use heat to disrupt fat cells and tighten skin, while ultrasound cavitation uses high-frequency sound waves to break down fat cell membranes. These methods are ideal for treating areas like the abdomen, flanks, thighs, and chin. Each non-surgical fat reduction method has its own mechanism of action, indications, and expected outcomes. The choice of treatment depends on the patient's body type, the amount of fat to be reduced, and their aesthetic goals. These procedures typically require multiple sessions to achieve optimal results, and the full effects may become visible over several weeks or months as the body processes the treated fat cells. Non-surgical fat reduction treatments are generally well tolerated, with common side effects including temporary redness, swelling, bruising, and numbness in the treated area. Patient consultation is essential to discuss realistic expectations, potential risks, and to ensure the patient is a suitable candidate for these body contouring procedures. Maintaining a healthy lifestyle is crucial for long-term results. Hair removal techniques. Unwanted hair is a common cosmetic concern, and various techniques are available for its removal, ranging from temporary to long-term solutions. Temporary methods include shaving, waxing, threading, and depilatory creams, which remove hair at or just below the skin surface. While convenient, these methods require frequent repetition and can sometimes lead to skin irritation or ingrown hairs. Understanding the hair growth cycle, which includes anagen, growth, catagen, transition, and telogen, resting phases, is essential for effective long-term hair removal. Treatments targeting hair follicles are most effective during the anagen phase, when the hair is actively growing and contains the most pigment. Long-term hair reduction methods primarily involve laser hair removal and intense pulsed light, IPL. These technologies work by emitting light energy that is absorbed by the melanin pigment in the hair follicle, converting to heat and damaging the follicle to inhibit future hair growth. Multiple sessions are required to target hairs in their active growth phase and achieve significant reduction. Electrolysis is another permanent hair removal method that uses a fine probe to deliver an electrical current directly into each hair follicle, destroying it. The choice of method depends on factors such as hair color, skin type, treatment area, and patient preferences. Proper consultation and patch testing are crucial to ensure safety and efficacy, especially with energy-based devices. Platelet-rich plasma (PRP) therapy. Platelet-rich plasma (PRP) therapy is an innovative regenerative treatment gaining popularity in cosmetic dermatology for its ability to stimulate natural healing and rejuvenation. PRP is derived from the patient's own blood, which is drawn and then processed in a centrifuge to separate the plasma rich in platelets. These platelets contain a high concentration of growth factors and cytokines, which are crucial for tissue repair, collagen production, and cellular regeneration. When injected into the skin or scalp, PRP promotes a cascade of healing responses, leading to improved skin texture, elasticity, and hair growth. It is a natural and minimally invasive approach to aesthetic enhancement. In cosmetic dermatology, PRP is commonly used for facial rejuvenation, often referred to as a vampire facial when combined with microneedling to improve fine lines, wrinkles, and skin tone. It is also highly effective for treating hair loss by stimulating dormant hair follicles and promoting new hair growth on the scalp. The procedure involves a blood draw, centrifugation, and then injecting the PRP into the target areas. Multiple sessions are typically recommended for optimal results, with effects gradually becoming visible over several weeks. Potential side effects are minimal, usually limited to temporary redness, swelling, or bruising at the injection sites, as it uses the patient's own biological material. Patient selection and proper sterile technique are paramount for safety and efficacy. Microneedling and RF microneedling. Microneedling, also known as collagen induction therapy, is a minimally invasive procedure that involves using a device with fine needles to create controlled microinjuries in the skin. These microinjuries stimulate the body's natural wound healing process, leading to the production of new collagen and elastin. The treatment improves skin texture, reduces the appearance of fine lines, wrinkles, acne scars, and stretch marks, and minimizes pore size. It also enhances the penetration of topical serums and growth factors applied immediately after the procedure. Microneedling is safe for most skin types and offers significant skin rejuvenation with relatively minimal downtime. The depth of needle penetration can be adjusted based on the specific skin concern and treatment area. Radiofrequency (RF) microneedling combines traditional microneedling with the delivery of radiofrequency energy into the deeper layers of the skin. The needles create microchannels, and simultaneously, RF energy is emitted from the needle tips, heating the underlying tissue. This controlled thermal injury further stimulates collagen and elastin production, leading to more significant skin tightening and remodeling compared to traditional microneedling alone. RF microneedling is particularly effective for treating deeper wrinkles, skin laxity, and more severe scarring. Both procedures require proper sterile technique and patient preparation. Post-procedure care typically involves gentle cleansing, moisturizing, and strict sun protection to support feeling and optimize results. Understanding the nuances of each technique allows practitioners to tailor treatments for diverse patient needs. Scar management and revision. Scar management and revision are important aspects of cosmetic dermatology, aiming to improve the appearance and texture of various types of scars. Scars can result from injuries, surgery, acne, or burns, and their appearance depends on factors like wound healing, genetics, and location. Common scar types include atrophic scars, depressed, often from acne or chickenpox, hypertrophic scars, raised, red, and itchy, confined to the original wound boundary, and keloid scars, raised, firm, and extending beyond the original wound boundary. Understanding the characteristics of each scar type is crucial for selecting the most effective treatment strategy. Early intervention can often lead to better outcomes. A multimodal approach is often employed for scar revision, combining different techniques to achieve optimal results. Treatments include topical silicone gels or sheets to flatten and soften scars, corticosteroid injections to reduce inflammation and flatten hypertrophic or keloid scars, and chemical peels or microdermabrasion for superficial textural improvements. Laser therapies, such as fractional non-ablative or ablative lasers, are highly effective for remodeling collagen, improving texture, and reducing redness. Surgical excision may be considered for severe or wide scars. Dermal fillers can be used to elevate depressed atrophic scars. Patient education on realistic expectations, potential side effects, and the need for multiple treatments is essential for successful scar management. Hyperpigmentation disorders treatment. Hyperpigmentation, characterized by darkening of the skin, is a common cosmetic concern resulting from excess melanin production. Various disorders fall under this category, including melasma, sunspots, solar lentigines, post-inflammatory hyperpigmentation (PIH), and freckles. Melasma often appears as patchy brown or gray-brown discoloration on the face, frequently triggered by hormonal changes, sun exposure, and genetics. Sunspots are typically small, dark spots that develop on sun-exponent areas due to cumulative UV damage. PIH occurs after skin injury or inflammation, such as acne or eczema, leaving behind dark marks. Effective treatment requires accurate diagnosis and a multifaceted approach to reduce existing pigmentation and prevent recurrence. Treatment strategies for hyperpigmentation disorders often involve a combination of topical agents, chemical peels, and light-based therapies. Topical treatments commonly include hydroquinone, a potent skin lightener, as well as retinoids, azelaic acid, kojic acid, and vitamin C, which work to inhibit melanin production and promote cell turnover. Chemical peels, particularly those containing AHAs, BHAs, or TCA, can exfoliate pigmented cells and improve skin tone. Laser and intense pulsed light (IPL) therapies selectively target melanin, breaking down pigmented lesions. Strict sun protection with broad-spectrum sunscreen is paramount for preventing new pigmentation and maintaining results. Patient education on consistent sun protection and adherence to treatment protocols are crucial for successful management of hyperpigmentation. Acne and rosacea management. Acne and rosacea are two distinct but common inflammatory skin conditions frequently managed in cosmetic dermatology. Acne vulgaris is characterized by comedones, blackheads and whiteheads, papules, pustules, nodules, and cysts, primarily affecting the face, chest, and back. It results from a combination of excess sebum production, follicular hyperkeratinization, bacterial proliferation, P. acnes, and inflammation. Rosacea, on the other hand, typically presents as persistent facial redness, flushing, visible blood vessels, telangiectasias, and sometimes papules and pustules, usually affecting the central face. Understanding the pathophysiology of each condition is crucial for developing effective and tailored treatment plans. Both conditions can significantly impact a patient's quality of life and self-esteem. Management strategies for acne and rosacea often involve a combination of topical and oral medications, as well as in-office procedures. For acne, topical retinoids, benzoyl peroxide, and antibiotics are commonly used, while oral antibiotics, isotretinoin, and hormonal therapies may be prescribed for more severe cases. In-office treatments include chemical peels, microdermabrasion, and laser/light therapies to reduce inflammation, kill bacteria, and improve scarring. Rosacea treatment focuses on reducing inflammation and redness, often with topical metronidazole, azelaic acid, or ivermectin. Oral antibiotics can help with inflammatory lesions. Laser and IPL therapies are highly effective for reducing facial redness and visible blood vessels. Lifestyle modifications, such as avoiding triggers and using gentle skincare, are also vital for both conditions. Patient education on long-term management and adherence to treatment is key. Anti-aging strategies and treatments. Anti-aging strategies in cosmetic dermatology focus on preventing, reversing, and minimizing the visible signs of skin aging, which include fine lines, wrinkles, loss of elasticity, sunspots, and dullness. Aging is a complex process influenced by both intrinsic factors, genetics, cellular metabolism, and extrinsic factors, UV radiation, pollution, lifestyle. Understanding these factors allows for a comprehensive approach to anti-aging. Prevention is key, with strict sun protection being the most crucial measure to mitigate photoaging. A healthy lifestyle, including a balanced diet, adequate hydration, and avoidance of smoking, also plays a significant role in maintaining youthful skin. Early intervention with appropriate skincare and treatments can significantly delay the onset of visible aging. A wide array of treatments are available to address existing signs of aging. Topical retinoids, antioxidants, and peptides stimulate collagen production and improve skin texture. Chemical peels and microdermabrasion exfoliate the skin, reducing superficial imperfections. Laser and light therapies target pigmentation, redness, and stimulate collagen remodeling for overall rejuvenation. Injectables like botulinum toxin relax dynamic wrinkles, while dermal fillers restore lost volume and smooth static lines. Microneedling and RF microneedling further enhance collagen synthesis and tighten skin. A personalized anti-aging plan often combines several modalities to achieve optimal and natural-looking results, tailored to the individual's specific concerns and skin condition. Continuous patient education on maintenance and protection is vital for long-term success. Cosmetic dermatology for diverse skin tones. Treating diverse skin tones in cosmetic dermatology requires specialized knowledge and careful consideration due to unique anatomical and physiological differences. Skin of color, including Fitzpatrick skin types 4 to 6, is more prone to certain conditions, such as post-inflammatory hyperpigmentation, PIH, keloids, and melasma. It also tends to have a thicker dermis and more compact collagen bundles. While these skin types may show fewer signs of photoaging, like fine lines and wrinkles, they are more susceptible to dyspigmentation issues. Understanding these distinctions is crucial for selecting appropriate treatments and avoiding adverse outcomes. A one-size-fits-all approach is ineffective and potentially harmful when treating diverse skin tones. Many traditional cosmetic procedures need to be modified or approached with caution when treating skin of color. For instance, Aggressive chemical peels or certain types of lasers can lead to PIH or scarring if not used with appropriate parameters. Gentle peels, lower energy settings for lasers, and non-ablative or fractional non-ablative lasers are often preferred. Hydroquinone and other melanin-inhibiting agents are frequently used for hyperpigmentation. Microneedling and PRP therapy are generally safe and effective across all skin types. Patient education on sun protection is paramount, as UV exposure can exacerbate pigmentation issues. Practitioners must be proficient in assessing diverse skin types, understanding their unique responses to treatments, and tailoring protocols to ensure safe, effective, and aesthetically pleasing results for all patients. Pre- and post-procedure care. Optimal pre- and post-procedure care is fundamental to ensuring patient safety, maximizing treatment efficacy, and minimizing complications in cosmetic dermatology. Pre-procedure care involves thorough patient education, including instructions on avoiding certain medications, for example, blood thinners, supplements, or topical products, for example, retinoids, that could increase the risk of bruising, bleeding, or irritation. Patients may be advised to start specific topical agents, such as hydroquinone or retinoids, several weeks before a peel or laser treatment to prepare the skin and enhance results. Strict sun protection is also crucial in the weeks leading up to many procedures. A detailed discussion of what to expect during and immediately after the procedure helps alleviate patient anxiety and ensures compliance. Post-procedure care is equally vital for proper healing and achieving the best possible outcomes. This typically includes instructions on gentle cleansing, moisturizing, and diligent application of broad-spectrum sunscreen to protect vulnerable, healing skin from UV damage and prevent post-inflammatory hyperpigmentation. Patients are often advised to avoid strenuous exercise, excessive heat, and certain skincare products for a specified period. Depending on the procedure, specific wound care instructions, such as applying occlusive ointments or cold compresses, may be provided. Follow-up appointments are scheduled to monitor healing, assess results, and address any concerns or complications. Clear, written instructions and open communication are essential components of effective pre- and post-procedure management. Managing complications and adverse events. Despite meticulous planning and execution, complications and adverse events can occasionally arise in cosmetic dermatology procedures. Recognizing, preventing, and effectively managing these occurrences is a critical skill for any practitioner. Common minor side effects include temporary redness, swelling, bruising, and tenderness, which usually resolve on their own. However, more significant complications can range from infections, allergic reactions, and persistent discoloration to scarring, nerve damage, or vascular occlusion, particularly with injectables. A thorough understanding of potential risks associated with each procedure, along with detailed anatomical knowledge, is essential for prevention. Patient selection and adherence to sterile techniques are also paramount in minimizing adverse events. Prompt identification and appropriate management of complications are crucial to mitigate their impact and ensure patient safety. This includes having emergency protocols in place, such as hyaluronidase for hyaluronic acid filler complications, and being prepared to administer antibiotics for infections or antihistamines for allergic reactions. Continuous education, participation in workshops, and staying updated on best practices are vital for honing these skills. Open and honest communication with the patient, providing reassurance, and guiding them through the recovery process are also essential aspects of managing adverse events. Learning from every experience, both successful and challenging, contributes to becoming a more competent and responsible cosmetic dermatologist. Ethical and legal aspects. Practicing cosmetic dermatology involves navigating a complex landscape of ethical and legal considerations. Maintaining patient confidentiality, ensuring informed consent, and adhering to professional boundaries are paramount. Informed consent requires a comprehensive discussion of the proposed procedure, its benefits, risks, alternatives, and expected outcomes, ensuring the patient makes an autonomous decision. Practitioners must avoid making false or exaggerated claims about treatment efficacy and always prioritize patient well-being over financial gain. Ethical practice also extends to managing patient expectations realistically and knowing when to decline a procedure if it is not in the patient's best interest or if they exhibit body dysmorphic disorder. Professional integrity and transparency are the cornerstones of ethical cosmetic practice. Legal aspects in cosmetic dermatology include compliance with local, national, and international regulations regarding medical practice, advertising, and product usage. This involves understanding scope of practice, licensing requirements, and proper documentation of all patient interactions and procedures. Malpractice liability is a significant concern, emphasizing the need for meticulous record-keeping, adherence to established protocols, and continuous professional development. Advertising of cosmetic procedures must be truthful, non-deceptive, and avoid exploiting vulnerable individuals. Staying informed about evolving legal standards and ethical guidelines is crucial for protecting both the practitioner and the patient. Engaging in continuous professional development and seeking legal counsel when necessary are essential practices for responsible cosmetic dermatologists. Practice management in cosmetic dermatology. Effective practice management is essential for the success and sustainability of a cosmetic dermatology clinic. This involves a range of administrative, operational, and financial considerations. Key aspects include developing a robust business plan, managing finances, and implementing efficient scheduling and patient flow systems. Staffing is crucial, requiring the recruitment, training, and retention of qualified and compassionate personnel, including receptionists, nurses, and estheticians. Creating a positive and professional work environment fosters team cohesion and enhances patient experience. Understanding market trends and patient demographics helps in tailoring services and marketing strategies effectively. A well-managed practice ensures smooth operations and allows practitioners to focus on patient care. Marketing and patient acquisition are vital components of practice management in a competitive cosmetic market. This includes developing a strong brand identity, utilizing digital marketing strategies such as social media and search engine optimization, and building a positive online reputation through patient reviews. Exceptional patient experience from the initial consultation to post-procedure follow-ups is the best form of marketing, leading to referrals and repeat business. Implementing effective inventory management for products and supplies, ensuring compliance with health and safety regulations, and staying updated on technological advancements are also critical. Continuous evaluation of practice performance and adaptation to changing industry demands are necessary for long-term growth and success in cosmetic dermatology. Emerging technologies and trends. The field of cosmetic dermatology is dynamic, constantly evolving with the introduction of new technologies and emerging trends. Staying abreast of these advancements is crucial for practitioners to offer the most innovative and effective treatments. Current trends include a growing demand for non-invasive and minimally invasive procedures that offer natural-looking results with minimal downtime. Personalized medicine, where treatments are tailored based on an individual's genetic makeup, skin microbiome, and lifestyle, is gaining traction. The integration of artificial intelligence, AI, and machine learning for enhanced diagnostics, treatment planning, and outcome prediction is also on the horizon. These technologies promise to revolutionize how cosmetic dermatology is practiced, offering greater precision and customization. Further emerging technologies include advanced energy-based devices, such as next-generation fractional lasers, focused ultrasound, and enhanced radiofrequency systems, which offer improved efficacy and safety profiles for skin tightening, resurfacing, and fat reduction. Regenerative aesthetics, utilizing stem cells and exosomes, are being explored for their potential in skin rejuvenation and hair restoration. The development of smart cosmeceuticals with targeted delivery systems and bioresponsive ingredients is also a significant trend. Teledermatology and virtual consultations are expanding access to care, Continuous research and development are driving these innovations, pushing the boundaries of what is possible in aesthetic enhancement. Practitioners must engage in lifelong learning to integrate these advancements responsibly and effectively into their practice, ensuring they remain at the forefront of the field. Conclusion and future outlook. The Diploma in Cosmetic Dermatology provides a comprehensive foundation for professionals seeking to excel in this rapidly expanding field. We have explored the fundamental anatomy and physiology of the skin, diverse skin types and conditions, and the critical importance of patient consultation and assessment. The course delved into a wide array of non-surgical aesthetic procedures, including advanced topical agents, chemical peels, microdermabrasion, laser and light therapies, and various injectables like botulinum toxin and dermal fillers. We also covered specialized treatments such as sclerotherapy, non-surgical fat reduction, hair removal, PRP therapy, and microneedling, alongside essential topics like scar management and hyperpigmentation treatment. The emphasis throughout has been on evidence-based practices, patient safety, and achieving natural, aesthetically pleasing results. Looking ahead, the field of cosmetic dermatology is poised for continued growth and innovation. Advances in regenerative medicine, artificial intelligence, and personalized treatment approaches will further refine our ability to enhance skin health and appearance. The demand for safe, effective, and minimally invasive procedures will only increase, driven by evolving patient expectations and technological breakthroughs. Practitioners must commit to lifelong learning, continuous professional development, and adherence to the highest ethical and legal standards. By embracing new knowledge and technologies responsibly, cosmetic dermatologists will continue to play a vital role in helping individuals achieve their aesthetic goals and improve their quality of life, shaping the future of beauty and wellness.